things, don't forget, we are streaming live over at supertalk.fm. We're also streaming from that SuperTalk Mississippi app. You can always find us, too, on your local SuperTalk Mississippi radio station. But don't forget to watch us. We are on your computer, your mobile device. Just head on over to SuperTalk TV. And I know the session is over, but we got some good news and some good things that happened during that time. Joining us today is Laken Lamp. She's the Government Relations Director with American Heart Association, and they were able to pass a bill unopposed. It's like you never hear that.
I know, so rare.
It's so rare in that and in your work, but it also just brings to light that, hey, there's sometimes both sides of the aisle can come together and say this makes sense, and let's just sort of get it through and go at it. So it was the bill to require cardiac emergency response plans in Mississippi schools, and it was actually signed and put into law. So as a mom of two young girls, one who's just moving into middle school, getting active in her different sports of choice, this makes me happy. Yeah. So it feels like everyone sort of feels that way. How did this get started? Where did you guys see maybe there were some gaps in what was going on in our schools and that something like this could help bridge those?
So on a national level, actually, this is a priority for the Heart Association. Ever since Damar Hamlin experienced cardiac arrest on the field, this has been an effort in partnership with the NFL. And so they made it a priority alongside us to make sure that everyone was trained in CPR and knew how to use an AED. And so that kind of trickled down into this idea of, well, we know that schools don't necessarily prioritize having a cardiac emergency response plan. A lot of schools have a medical emergency response plan, but cardiac specific, not so much. So we just started working on it and realized that there are a lot of schools in Mississippi that actually do have versions of them, but needed a little help as far as guidance on what that should look like and what a national standard would look like as far as the implementation of that. So.
Because thank God they are still rare. Mm-hmm. It's not like it's always going to happen, which is probably why it just isn't already in place. They hadn't thought about it. It's not because they don't want to have one in place. But they are becoming more popular as more kids get into activities. And there's a lot of reasons sort of behind that, not to be discussed today. But it starts to bring up the light of, God forbid, if it goes down, you want the school to at least know the steps that needs to be taken. The plan that obviously was pushed through, is that something that was backed by the Heart Association or came up from people smarter than us when it comes to health care? Like how was the plan developed?
Definitely by people who are smarter than me. It's all research-based. And so a lot of it's backed by the data that we know, which is, there are 23,000 kids across the nation that have cardiac arrest or experience it on an annual basis. And there are hundreds of thousands of people who experience it just throughout their adult life annually.
So I guess if a parent or a coach or athlete or anybody else on the sidelines was to experience it, the plan could also be put in place for them. So it's not just for the student athlete.
Exactly. Because when you think of Mississippi, we use school grounds as a way to, do many things. It's voting places. It's sometimes churches congregate there, performing arts. So it's a community center in a lot of cases around Mississippi, especially in the more rural areas of Mississippi. So we want it to be something that is published, highly visible, and so anyone can look at it and know the exact steps they need to take in order to respond in the case of cardiac arrest. So that's kind of the overall point.
Do you know it?
Yeah. So, it's the first thing you want to do is call 911. And you need to be able to look at the situation and assess and say, hey, this person's having experienced cardiac arrest or having a heart attack. And then you call 911. And then in the meantime, you start compressions immediately. And if you have an AED on site, that's the second thing you do. And the whole point is to also have a cardiac emergency response team in place. So that's another important aspect of it, is that when it comes to a school setting, there are people you want to designate to have certain tasks. So especially when it's during school hours or if there's a game happening on site. But as far as the order of events, it's, acknowledge what's happening, make sure you know that it's a medical emergency, call 911, start compressions, get the AED, use the AED. And then
you wouldn't think it would have to be step 5,
but we want people to know how to use it because it's not as intimidating as people realize. In a lot of cases, some of them have vocalized instructions now. They'll tell you explicitly what to do with the AED and whatnot. And so it's a lot easier than people think. It's very intimidating in a lot of cases, but if you know how to do these things, it's
especially
much easier.
Now if you're talking about on Friday night for the football game or practice as we go through the summer, if there's someone who's designated, they've already ran through it, they feel confident with it.
Exactly.
It's like, hey, this just boom, 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 everybody goes to their place and come back. You've just now made it more efficient to handle the crisis instead of just floundering around.
Correct.
Hoping people sort of figure it out. I know the AEDs can be kind of expensive. Is it required that schools have these now, or is it just if you have it, use it in the plan, or is that kind of like a progression to it?
Ultimately, we want all schools to have them. Nationally speaking, we want them to be 1 to 3 minutes apart from one another at a school setting and at an athletic facility. And that's just the standard nationally. That's what athletic trainers are told. So we want that to be something that we abide by eventually, but because of the cost and the implementation, we know it's going to take time in order for that to happen. So while we know that if not all schools have an AED, most of them do.
And they're working towards that.
Exactly. We want to make sure that we are used as a resource, because the Heart Association is a resource on the community level, and people don't really realize that in a lot of cases, but we have community impact directors that work on this at different schools across the state. We have our development team who does fundraising for, work that's being done in Mississippi, and even with policies like this. And then nationally, we have resources that we can share with people when it comes to finding a vendor that not only sells AEDs, but also does all of the regulatory aspects of it. So making sure that they're checked annually and up to date and being tested on an annual basis and whatnot. So
who is usually poised as the leader of that task force for the CERP? Like, is it a coach? Is it like an assistant principal, or is it different for every school? Kind of like a health and wellness committee. The school figures out who's the best for that.
Yeah, it's definitely circumstantial, because, we say that every time we talk to anyone at a school about this. We want to start with where they're at, because a lot of schools don't have a nurse at every school. They have a district-wide nurse, we don't know if she's going to be at the right place at the right time, right? But Mississippi actually requires that all coaches and assistant coaches be trained in first aid, CPR, and AED use. So ideally, we would have coaches or an athletic administrator of some sort on the team. Anyone that makes sense. Athletic trainers, if they're on site, nurses, teachers, anyone who just happens to already be CPR certified, that would be fantastic. But it's just whatever makes sense to that specific school system.
For parents, caregivers, grandparents, as we're moving into, I know, summer camps and summer practice and all that's really gearing up, are these questions that we could ask coaches? Hey, do you have a CRP plan in place? Do you know what that is? Is that something, if they don't, can they contact and get in touch with the American Heart Assoc? That kind of
Yeah, absolutely.
Especially if you have a child has a history. Well, that should be a whole other thing. Like, if your child has a heart condition, you should be open about that. But
yeah, and it's definitely, the days are getting hotter. So I would rather parents have that conversation and be directed towards us. Because if we can't answer your immediate question, we know who to direct you to. So definitely use us as a resource and talk with the people who are looking after your children at practices and at schools and whatnot.
Someone asked, and you may not be an expert on AEDs, but what is the life of one? Is that something that if a school got one and it sat on the wall for 10 years and hadn't been used,
if it hasn't been used, I'm not really sure. Yeah. But I know that they need to be checked on an annual basis, just like you would do, a fire drill of sorts, now we do active shooter drills. We want them to do drills when it comes to this cardiac emergency response plan. And so it's an annual check.
To make sure all cylinders are sort of firing. What was it like getting a home run on both sides? I know not all policy.
Unprecedented.
Yeah. So you got no pushback. What was it like knowing that, this is going to impact, kids forever?
It was great. It's a good feeling to know that you're going to help kids, but also parents, because kids are at school 8 hours a day. That's just, we need these kind of provisions in place in order to make sure that they're healthy and safe, and that schools are working well with our local EMS, and they just have their, as many resources as they need to make sure that everyone is safe on
I just
grounds.
like the idea that it's like, okay, we've thought it through. You have a plan. I mean, it's the same thing with tornado drills, fire drills, and why you practice it. So in case that happens, we just know it's because when time is of the essence,
right?
And when it comes to a cardiac crisis, time is absolutely of the essence when it comes to especially, well, anybody. I was going to say our children, but
every second counts, regardless of age, who you are, for sure.
Well, congratulations on that. And if people want to know more about what the American Heart Association is up to here in Jackson for their own community or with their own needs or even in government, how do they find out more?
You can reach me at my personal email at laken.camp@heart.org. And of course, if you just Google us, you'll have our office number on hand, and we're pretty easy to search for sure. So,
absolutely. All righty. Well, you guys stick with us. We got more for you coming up next.